What is self-care? Self-care means basically what it looks like. It's taking care of yourself. They're the actions that we take to maintain and create well-being in ourselves. Why is practicing self-care important? Well, doing so helps you to maintain your physical and mental health, and it also helps you to deal with the stresses of life, which you're probably all too familiar with. What is mental illness and how serious is it? Mental illness is something that you are diagnosed with by a professional when they've established that there's something about your mental state that is abnormal and causing an impediment in your life. So, how many people have mental illness? How serious is it? In 2010, there was a survey of over 10,000 adolescents aged 13 to 18 across the United States, and they found that about half of them had experienced a mental disorder or were continuing to experience one. The two mental disorders I'd like to focus on today are mood and anxiety disorders, because they're probably the ones that you can relate to most, even if you don't have a disorder. Mood disorders are problems with your mood. For example, if you're feeling very down a lot of the time, that would be depression or depressive disorder. Or another example would be if you're feeling very down and you're also feeling very up sometimes, and you're kind of bouncing between those two states. That would be more like bipolar. Anxiety disorders are when you deal with the excessive amount of worry that is hard to control and also interfering with your life. In a room of 100 adolescents, about 32 of them would have experience with anxiety disorders, and about 14 of them would have experience with mood disorders. Mental disorders also begin early in life. 50% of disorders begin by age 14. 75% of them begin by 24. These results were based on a survey on many adults. And I think it's important to remember that mental disorders are not permanent. They're treatable, whether that means seeing a professional and getting it treated that way, or learning strategies to deal with them on your own. The last thing I'd like to show you guys is a table that shows the impact that mental disorders can have compared to other kinds of diseases and similar things. This table shows that in young people, depression or unipolar depressive disorders have the highest disease burden. And this study of disease burden was calculated by basically looking at the number of healthy years of life that you lose due to your disease or similar thing. As you can tell, mental disorders can be very serious, and you can even see disorders such as schizophrenia and bipolar disorder near the top. Bipolar, which was mentioned earlier. In summary, mental disorders are serious. They affect a lot of adolescents, and they tend to start young. For this reason, it's important that we learn tools to manage these things, because even if we don't have experience, and we never ever have experience with a disorder, mental health will always be something that we have to deal with.
Alright, so I just wanted to talk about stress today. There is good and bad stress, and I just want to emphasize that actually everyone has stress. So to kind of give you a perspective on the good and bad stress, I'll go over this graph here. So on the left, you see this red area. You have low stress here, but you also have low performance. You're feeling kind of bored. you're not interested in this, so you're probably not going to do that great. And then you have the very high stress over here at the right red area. You're having this burnout. You may feel super anxious, and you're just not going to do as great. And then we have this spot in the middle where you're kind of stressed, but it's the good kind of stress. It's the good kind of stress that motivates you and helps you focus on what you're doing. All right, so stress in high schoolers. So research has showed that chronic stress in adolescents increases your risk for long-term anxiety in life. So basically, this means that you are vulnerable at this age to acquire anxiety, and this anxiety will stick with you in at least your young adulthood, if not longer. And this is happening with so many people at this age group. And there's many factors that contribute to this stress in teens. So we all have family, we have friends, we have this peer pressure element going on in high school. You're starting to get a social life. We have all of these assignments that are due. We may have a job. Some people have jobs in high school. And other responsibilities that are coming along because we're starting to go into adulthood. So this Baltimore City study found that shockingly, well, maybe not shockingly, the Baltimore City study found that teens are basically more stressed than adults when it's during the academic year. So teens rated their stress level at a 5.8 out of 10 during the school year. Adults said their daily stress was about 5.1 out of 10. And just to show that there is actually a big amount of stress associated with school, they had a summer break rating for teens, and they said it was 4.6 out of 10. So their stress level went down 1.2 points just because they're out of school. So that probably says something. So the American Psychological Association is pretty big in psychology. It is the organization for credibility, for research, and everything. And they did a study. They found that yes, teens are feeling overwhelmed. They're feeling depressed and sad. They're feeling tired. And shockingly, some are skipping meals due to stress, which is really not good. And teens are more likely to report stress, had little to no impact on their physical or mental health. So this is basically saying that teens are used to this stress, so they don't really identify it as being impactful to them. Okay, so there are stereotypes of teens, and this does relate to stress and anxiety, actually. So we have this self-fulfilling prophecy that happens a lot. We see this in TV, movies, and even in real life, where our parents expect us to do these bad behaviors because we're teens. And the self-fulfilling prophecy makes it to where we are actually more likely to do these behaviors. We're wanting to live up to our parents' expectations, and if they give us this expectation, it will probably happen. It's more likely to happen. And then the world is super different now from when it was for older generations, and we're so unsure of our future. It's going to be so different. These uncertainties are actually linked with a lot of anxiety in the younger generations. And then we also have the role of technology, especially social media, because of all those likes and everything. It could affect our self-esteem, our happiness, and other things. So, stress is super impactful on us. I wanted to break it down into how it affects our mind, our body, our mood, and our behaviors. So, it affects our mind by decreasing our ability to solve problems. We also can't really pay attention. We don't have inhibition. We're less successful in task management. So we're not able to manage all the tasks that we want to do, and then we're also not able to plan how to do these tasks or plan. So we can't plan out how to do these tasks. And then we have this decreased ability to store knowledge, which basically impacts our learning directly. Our brain changes a little bit with stress, and we aren't able to store what we're learning, which is extremely bad for academic life. All right, our body it can cause tension and pains, like headaches, I'm sure. All right, so body, it can cause tension and pain. This includes headaches, muscle tension or pain. We can also have fatigue. We can have sleeping problems, and this isn't limited to just not having enough sleep. It can also mean that we get too much sleep. For our mood, we have anxiety, and we do have sadness or depression at the very bottom. And I do want to point that out because these are becoming more prominent in our society today. We also have restlessness, and we feel overwhelmed, which could be coupled with that anxiety. We might feel irritable or angry. And we have behaviors. So these eating habits, I did mention that earlier, where some people were neglecting to eat because of their stress. But we also have the opposite where you overeat. Behaviors, we could do the outbursts. So for outbursts, that connects with that irritability or anger from the mood section. And we have the social withdrawal. So we may withdraw socially because we are having these outbursts that we're not able to control very well, or because we're feeling sad and we don't really want to feel like we're burdening anyone with that sadness. And then, of course, there are other bad coping mechanisms that could be used.
Alright, so for the next topics, we will be talking about the bad coping methods. Alcohol, tobacco, caffeine, and sleeping habits can all affect your health in really positive or negative ways. Alcohol, some of the main effects are on the underdeveloped brain. It can impede your judgment. It can cause you to make really bad choices. And it can also have negative health effects as well as social effects. Some of the social effects could be that you end up in Alcoholic Anonymous groups. If you make bad decisions while you're intoxicated, it can be that you're in prison. Any of these could be really bad coping methods for it, results of the coping method, rather. The figure at right was for the alcohol coping method. As you can see, right around 11,000 adolescents start drinking from age 12 to 17 during the summer months, June and July. If you also look at the ends of the graph, January and December, these months are holiday months, so it could have an aspect of depression or just the holiday blues that go into them. So, a good information tip with this is that you just really need to reach out to someone if you're feeling the holiday blues. Tobacco and caffeine are both drugs that can have good feelings associated with them. Tobacco is a stimulant, so it could give you the feeling that keeps you awake, as well as caffeine. But some of the negative health effects for tobacco could be smoking, obviously, that would cause lung damage or also night vision damage. Tobacco often causes this because it pulls the blood away from your capillaries in your eyes. Caffeine, on the other hand, sometimes when you get too much of a good thing, it can be a bad thing. So there's a point at which caffeine is okay, but if you use too much of it, an unhealthy amount can lead to very unhealthy side effects. Some of the studies that I looked into showed that jitteriness, nervousness, or just a inability to focus are some of the issues that can be linked to too much caffeine. It also affects your sleeping cycle, which we'll talk about next. Sleeping habits, getting too much or getting too little can be negative things. Too much can often cause you to feel lethargic or just not want to go anywhere because your body is used to being in that position and you just want to stay there. Getting too little can also make you feel lethargic and you just want to get that extra 10 minutes for the 50 minutes that you hit your snooze. Anyways, sleep is very important, and if you get too much or too little, it can damage the way that you conduct yourself and the way that your day goes. Moving on, procrastination and perfectionism, food and distraction. Procrastination and perfectionism are both something that have been seen a lot in students with a very high expectation for themselves. They focus too much on getting everything, every single detail perfect, and it drives them mad with how much that they have anxiety over it. As you continue to go on in life, and if you continue with habits like this, it can lead to a very large mental weight that you're carrying around. You're just constantly waiting for something to get done so you can make sure and have the relief that, you didn't have one small mistake that nobody's going to care about in 5 years. Anyways, procrastination, that is a little different than perfectionism. Procrastination, you're just waiting to get something done. That can cause a lot more anxiety and mental weight to be on you until that something is done. So, getting stuff done when you have time versus waiting until the last second is a lot better. It's also been seen that when people procrastinate, their work, the quality of their work, it goes down. So, it's better to get it done, be able to review it if you want, that is, and then just move on from there. Food. Now, binging and a healthy diet, those are two topics that are very difficult with college students or even just the younger generations. If they have a bad work schedule, they may be binging on unhealthy food in the early mornings, such as nurses, as one of the studies that I looked at showed. The stereotype of the freshman 15 is not very well known from some audiences, and it's a very true stereotype that has been seen in many young college students. in that when your diet is unhealthy, you're going to gain a lot of weight very quickly when you're not exercising properly, or you're just having a very low activity level. Binging on food, on the other hand, could just be another stress coping mechanism where you eat comfy food that gives you temporary relief, but in all reality, your body is hating you because it's building up very negative side effects for it. Distraction, screen time, and annoying friends. It's good to take breaks, but too much of a break or the wrong kind of break can also be negative. So, screen time can also be watching too much Netflix, just too much time on your phone. Basically, anything that is not the work that you need to be getting done and takes away the productivity level that you need to be at. Annoying friends. It's fun to hang out with friends. I love hanging out with friends, but if you have friends that are constantly demanding your attention and get mad at you for wanting to focus on school, then something's wrong and they need to check themselves. So they need to understand that school's important, or whatever you have going on is important, and that you need however much time to get it done. Shoot, a good friend might even come along and help you finish it. So, in conclusion, procrastination, perfectionism, food, and distraction, these are also very bad coping mechanisms that can draw your quality of work away and your time.
So now that we've gone over what self-care is not, and before we get into some of the more technical applications of self-care, I wanted to go over some of the day-to-day habits we can implement and a few techniques that take no more than 5 minutes and are super easy to incorporate into your day, but are still really effective. First, we need to address sleep hygiene. I know we've all heard the phrase and probably even lived by the phrase, you can sleep when you're dead, but it's actually super important to your physical and psychological health to get the appropriate amount of sleep each night, which is 7 to 9 hours. One 2016 study actually found that individuals who obtain an appropriate amount of sleep each night have a better chance at managing stress day to day. Next, building and nurturing your support system has a larger impact than you probably realize. In fact, research has found that individuals who have more social support are also more resilient to stress, so making time for your friends and family and those that genuinely have your back is an important part of self-care. And then lastly, I have downtime management. Usually the phrase we hear is work-life balance, but for most students, it's work, life, and study balance. We have a lot on our plates, and finding a way to manage it all in a way that works best for us can be difficult, but when we do, it really minimizes those feelings of being overwhelmed and reduces those feelings of anxiety and stress when it comes to completing daily tasks. The next two are just 2 quick exercises that anyone can learn and easily implement into their daily schedule. Deep breathing is especially useful because it elicits an almost immediate physiological response. A 2017 study looking at university students found that the use of deep breathing techniques led to an effective improvement in the management of stress in daily life and could exert positive influences on the stress conditions that students face during the course of his or her studies. And then the other exercise I have here is gratitude journaling. It's pretty self-explanatory. It's basically just the practice of writing down, truly acknowledging, and being mindful about the things that you are grateful for each day. There is research out there that shows that the experience of gratitude is associated with increased psychological and physical health in terms of lower symptoms of depression, increased feelings of positive affect, and satisfaction with life.
Hi, y'all. I wanted to talk to you about self-compassion and how mindfulness plays a role. So, self-compassion is defined into 3 different components: self-kindness, common humanity, and mindfulness. Self-kindness is how we treat ourselves. A lot of the times we talk to ourselves in a negative way, but I promise you your outlook on life will change if you talk to yourself the way you would talk to a friend. Then there's common humanity. We are all going to experience something negative at some point, whether it be failure, anxiety, death. We're all going to have to be face to face with that, and it's important we embrace it and embrace humanity rather than isolating ourselves because of these events. And the last, which we need the self-kindness and common humanity to have, is mindfulness, which is accepting the presence for what it is and not what we want it to be. Why should we bother practicing mindfulness? So Margot Helm was a doctorate, or had her doctorate, and was an RN who did a study where she had RNs practice mindfulness for 30 minutes a day. And after a few weeks, what she found is there was an increase of self-report from all the RNs, so of having relaxation states. So that's the self-report. And then she did another study where she found the physiological states, such as shaking and other bodily functions related to stress, had decreased since the RNs had started practicing mindfulness. A big one is there was a decrease in amylase, which is this marker in people's saliva that kind of indicates whether they're stressed or not. And the RNs who had practiced the mindfulness activities had a significant decrease in that element of their saliva. And probably the most important one for employers and for students is their work improvement had improved, and they had a decrease in the amount of errors they were making a day. That is huge. These are nurses, so the errors they make impact other people's lives. Some mindfulness exercises. I came up with 3 for y'all. The note-taking exercise, the mindfully working through pain, the ice exercise, and lastly, the mindful daily activity, which is in the shower. All of these resources came from the book Self-Compassion by Kristin Neff. She is a professor at UT and has her doctorate. She has studied positive psychology and self-care a lot. She's kind of the go-to woman. I recommend, if you're into practicing mindfulness and want to do further studies, reading this book, again by Kristin Neff. Let's talk about yoga, because yoga is cool too. Most yoga instructors practice mindfulness in their studios. There's a huge emphasis on being present in the moment, and it's a great exercise. So one, it keeps your mind and body healthy. Grace Farah, I think I'm saying that right, conducted an experiment of workers who practice yoga for at least 1 hour a day in an office setting. So this is your typical 9 to 5, and I think it relates more so for students. There was an improvement of well-being, and improvements of overall health, and boom, and improvements of the productivity at work. Your employers will love it, and for students, this can be applied to how you study and how you work towards your grades. All right, y'all. Thank you.
Music therapy is evidence-based clinical use of musical interventions. By evidence-based, I mean empirical evidence such as research that shows its effectiveness. The purpose of music therapy is to improve the quality of life of a person. There was a study conducted in 2004 that showed that whenever you listen to pleasant music, dopamine is released in the nucleus accumbens. In other words, your brain releases a chemical that makes you feel good. That is the dopamine neurotransmitter, which is often associated with feelings of excitation, happiness. As I say this, I want to add that passively listening to music or on your own time with your headphones is not the same as music therapy. In music therapy, you actively engage with music. Music therapy is used to promote wellness, manage stress, affects your mood, helps you change perceptions of situations, express feelings, and enhance memories. It also helps with depression. It's been used with patients that have Parkinson's, and it can be used with any population. According to Youth Mental Health America, your mental health has only worsened, and the struggle to manage stress continues to be a growing problem. Stress does not only affect your mental health, but it can do a number on your physical health. It increases cardiovascular risk, high blood pressure, and reduces life expectancy. There was a study conducted in 2016 by Lee where he exposed students to induced stress. He had 2 groups. One of those groups received music therapy as an intervention. Once he collected his data, he saw that the group that had music therapy had lower blood pressure and their pulse was also lower. There are quite a few forms of music therapy interventions. There's playing instruments, directed music listening, writing songs, music and relaxation exercises, and adapted instrument lessons. Whomever decides to go to music therapy will be involved with a music therapist. The music therapist is the one that provides the sessions, and they provide whatever they think is fit for you. Music therapists undergo a lot of training